Om. 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 Om Namo Bhagavate Vasudevaya Dhanvantaraye Amritakalashahastaya Sarvavayamim Vinashanaya Trailokyanataya Sarveshwaraya Om Shri Mahavishnave Namah. Om Namaste. Today I'm doing this video outside the surgical room because sometimes I have lots of things to say and I don't have time to do it in a surgical setting because we're also busy about lots of surgeries that have to be done in a day. So some videos you're gonna see that I'm outside the surgical room. Okay, for those who don't know me yet, my name is Karini. I am an anesthesiologist and an Ayurvedic student, and I'm trying to do a link between these two worlds. What I want to talk about today is how I've been observing Vata, Pitta and Kapha constitutional types and how they go on through some kinds of surgical procedures. Okay, sometimes what we do in anesthesiology for small procedures basically is when there is a local anesthesia applied to the patient on the skin where he's going to do that procedure, we do a sedation and not the general anesthesia. Okay, what is a sedation? It truly is another level. We use lots of drugs that are similar as the ones that we use in a general anesthesia, but we use them in a very lower doses when we just want to sedate the patient. When we sedate the patient, we don't exactly take all of his senses perception to zero. Like he may hear something, sometimes the patient will smell things, sometimes the patients will even feel things. So if the local anesthesia is not properly performed, a good sedation is not possible. Okay, saying that, what I really want to talk about today is how I've been trying to train my eye to get a glimpse of the patients for that little time that we anesthesiologists have with them just before the surgery, because most of them don't have a meeting with us prior to the surgery. We get to know our patients at the moment of the surgery. So I have little time to talk with him. And then what I'm trying to do is I'm trying to do a quick analyzation of his or her physical features and trying to think, oh, maybe this patient is a more Kapha person, or this patient is he or his is more a Vata person or a Pitta person. And I'm trying to correlate with how these people do in this situation where I'm just doing sedation and not a general anesthesia. What I've been observing is that the Vata type patients, they generally come to us. They're with more anxiety. They're patients that they're more scared about the procedure, and I noticed that during the procedure, there are patients that are more unstable. You know, when we give the sedation, they wake up or they go really down. Sometimes we have to be careful to not depress their ventilatory thrive, because we are not using mechanical ventilation in these cases. And there are patients, these Vata type patients are patients that go more unstable during these times. They demand more attention of us as an anesthesiologist, because we have to be really attentive to their vital signs, and so that they don't wake up in inappropriate times of the surgery. And it's a real I'm gonna say this, it's more difficult for us as an anesthesiologist to manage, because we can't get these people normally, that they don't do it, they don't stay in a same phase during the sedation. You know, they go up, they go down, they go up, they go down. Okay. Kapha like patients, they normally present themselves less anxious, and they're more cuddly kind, you know, they want to be your friend, they want to, oh, please take care of me. They're more emotional patients. Sometimes they maybe cry a little bit, depending on what surgery they're gonna do. Sometimes we need to use more drugs to be able to sedate these patients, but after they get in the level that we need, they normally stay there, and they're very easy for us to take care of, because they are really more stable in the way they behave with these sedatives. They are also patients. How they recover, I will talk about that later, okay? The Pitta type patient, I still don't have enough observations. Maybe I'll need much more. Obviously, I'll need much more, but Pitta type patients are those patients that come with lots of questions. The Pitta type, he probably already looked on Google all about the surgery and the anesthesiology, and he or she will be asking me what drugs I will use, and he will ask a lot of questions. He would like, this type of patient needs to show that he or she has more control of the situation, you know. Sometimes, depending on the anxiety, they can behave more like Vata types, or if they're less anxious, if you give them enough confidence, they will behave more like a Kapha patients, okay? In the recovery room, what I've been observing with this kind of surgery, with this kind of anesthesia, is that the Vata patients, they wake up really fast, you know. If you don't take care, they wake up before the surgery ends. It's troublesome to keep them sleeping, and they have the more complications. We use complications for things like they have more nausea and vomiting in the post-operative period. They have more shivering in the post-operative period too. I think they have a tendency to have more pain in the post-operative period too. The Kapha patients, they take a while to wake up, you know. Sometimes you have to stimulate them more, talk more to the patient, wake him up, ask how he or she is feeling, because if you let the Kapha patient in the recovery room with the residual effects of the drugs used in the sedation, that person will sleep the whole day long if you let them there, you know. You need to stimulate them to go. On the other hand, they have less complications. This type of patients is the patients that I've been seeing that have less vomiting and nausea in the post-operative period, and they have the least chance to present with shivering. Okay, the Pitta types, I will need more observation, but the Pitta type patients, it depends on the anxiety level. He sometimes will have a way of being more Vata type patient or a more Kapha type patient. Okay, I hope this wasn't too confusing for you to understand. These are just initial findings. It's not easy to evaluate these patients in such a small period of time that I have with them, because I get to know my patient practically in the surgical room or in the pre-operative room, and I have little time to talk with the person before the surgery. So I'm using basically my eyes to do a physical examination on what the body of that patient is being able to say to me, and not what he says to me specifically. The way he speaks or she speaks, it's for sure I'm using this information, but for now, what I'm more using is his or her physical aspects. Okay, so if there is any other anesthesiologist who studies Ayurveda there and would like to share the impressions, please go get in touch with me. I'm very curious, and I'll be back here talking more about Ayurveda and anesthesiology. I wish everybody a nice day. Namaste.